Hi everyone, my name is Gino Silvestri. I'm a D4 at Loma Linda University, and today I thought I'd share a little bit of my job searching experience and hopefully give you some tips and tricks on how to navigate through this sort of overwhelming and confusing phase of your dental school career. So a little background about me: I am a father of 2 kids, a 5-year-old daughter named Remy and a 2-month-old son, Theo, and I am the husband of my beautiful wife, Giselle. I have a family that I'm kind of carrying on my shoulders, so I want to find a location that will be suitable for a young family like mine. I'm sure you guys are already thinking about where you guys want to work, so I suggest maybe doing a quick Yelp search on the local dentists around those areas. Have in mind which potential dental offices that you might want to reach out to when D4 year comes along. Now, once you do that quick search around the area, you may notice that there are plenty of different dental offices that have different practice models. You may want to think about, after you graduate, do you want to go into a DSO or larger corporate type of dental office, or are you more into the private practice or group practice sort of setting? Now, there's a lot of pros and cons between which type of practice model you choose to go into. Like, for example, DSOs are really great to improve on hand skills and speed, whereas for private practices, and say you're an associate for an owner dentist, your production directly dictates how successful the dental office is. So you sort of have to make sure your skills are up to par and you're working as hard as you can. Now, how do I exactly apply for a job? There's a lot of resources that you can use to connect with hiring dentists, but I found Indeed to be the most helpful. I feel like Indeed is a very baseline way to sort of send out applications really easily. I also suggest to make a follow-up phone call to make sure that your application is being processed and to really show that you're interested in the position. Another resource that I use is this Facebook group called Dental Practice Matchmaker. This site is really cool because you have dentists that are looking to sell their practice or hire an associate, and you have new grads that are auctioning themselves out to potential employers. I actually posted a little bio about myself, sharing a little bit about my story, my interests, and my future vision as a dentist. And some of them actually got back to me and we scheduled a phone interview and discussed possibly meeting up in the future. Now you're preparing to do your phone or in-person interview. Now, I asked a lot of questions during my interview, but because of the sake of time, I'm just gonna list off a few that I'll definitely ask. First question I would ask is, how many new patients are you getting per month? Now, safe number is around 40 to 60, and that really ensures that there's enough patient pool to distribute between the owner dentist and you as the associate. And kind of as a follow-up, you can ask what kind of procedures the office does. Do they do molar endos? Do they refer out all the peds cases? Am I, as the associate, going to be doing the bread and butter type of appointments while my owner dentist gets to do the big surgical cases? Second question I would ask is, are there going to be any mentorship opportunities? Now, mentorship is very important and not a lot of private practices offer that, but you'd be very lucky if you can find an owner dentist that is willing to stay an extra day to teach you the skills that you need. Now, the third thing I would ask is the insurance contract the dental practice is working with right now. Now, ideally, fee for service is cash money, but of course there's going to be PPOs and maybe some HMOs that the dentist will be working with. That'll ultimately affect how much of an adjustment the insurance companies will be taking out of your collections. Usually it's about 30%. Now, going off of that, I would ask how you're going to be paid. Is there a daily minimum guarantee? It's usually around $600 to $750 a day. Am I going to be paid off of collections, or am I going to be paid off of productions? Collections basically means the money that the office currently has. So if your patient is not paying for the full treatment, that means the collection is actually less than what you're producing. Now, ideally, production is great because you don't really have to chase the patients down to pay the full amount. And at what percent? Usually around 25 to 30% would be great. Lastly, I would ask what kind of technology the office currently has. For example, if the office is doing implant procedures, do they have a CBCT to plan out the implant placement? Do they have a 3D scanner or a 3D printer to print out your surgical guides or your prosthesis? All right, and finally, when you actually go into the office to shadow them, I would look at these 3 things. Number 1, actually sit in their computer and look through their weekly schedule. That'll kind of give you an idea of how many patients he sees in a day. Number 2, I would take notes on how many hygiene, how many dental assistants there are, how many receptionists there are. Are there any systems they have in place? Systems meaning protocols to keep the office running smoothly. I would maybe ask the receptionist if they have like a script that they go off of when they answer phone calls, what kind of internal marketing they have, whether if it's like brochures or pamphlets. And most importantly, look at the materials that the dentist is using. So I would actually look into their supply closet, see what kind of materials that they use, take notes, take pictures on what the working time is, what the setting time is, so that way once you're actually hopefully working for that office, you already know what the workflow is like. Thank you guys for sticking to the very end. I know that was a lot, so if you have any other questions, make sure you follow me on Instagram and DM me, and I'll write back as soon as I can. Good luck as you guys approach D4 year, and have a blessed day.